had some inexplicable events occur in my life. I've been dealing with it alone. I haven't discussed it with my husband yet. I thought I'd come here to get a professional opinion.
Okay. So some events.
Looking back over 2 months ago, maybe 3, I had experienced a sudden, overwhelming fear that something terrible was going to happen. I didn't know how to handle it then. I dealt with it alone. And then just here a few weeks ago, maybe a month, I had the same event occur in the grocery store.
Okay.
This time, the clerk was able to call the EMS to get me to a hospital, only to have the doctors tell me that nothing physical had occurred. The
Okay.
heart attack that I thought I was having, the stroke that I thought I was having didn't occur.
Okay.
And so I was left thinking, well, what then? What happened? What is happening? And if it happens again, and how often is it going to happen? And what is it?
Okay, so let's go back to the first time. You called it an event. What was going on during that day? What were you doing?
Well, my life is pretty routine with the boys away in school. My husband still works a full day. I was just home doing laundry, dusting. There was a television show on, and all of a sudden, I was overcome with what I can't explain, fear. My heart palpitated really fast. Actually felt like my heart was going to burst right out of my chest. I still don't have words for it today. With the second occurrence and the doctors telling me that.
Let me focus it back in on that first one just for a second to make sure I get the complete picture. So you were at home. It was a typical day. And all of a sudden you had the fear. Your heart was beating fast.
Dizzy.
You were dizzy.
Yeah.
Okay. Anything else?
I remember leaving my handprint on the stereo component and realizing that my hands were really sweaty and my skin was mushy.
Mushy. Okay. And all of that was happening at once?
Yes. All of a sudden.
All of a sudden. And how long did that last for?
Seemed like what was forever. Must have been about 15 minutes, 10 minutes.
10 minutes or so. Okay, so dizziness and the palpitations, like you said, sweating.
Yes.
You're going.
My heart died. It really, it's what I can't explain today, but like I was going to die or I was having a heart attack or something seriously physical was happening.
Okay.
To me.
And that lasted about 10, 15 minutes.
Seems like forever.
It seemed like forever, yeah. That can be pretty intense. And then what happened after that 10 or 15 minutes?
I kind of got a hold of myself once I caught my breath because I couldn't breathe. If I wanted to make a telephone call, I couldn't speak. I was left with a feeling of helplessness. No one was there. I could not determine what had happened except for it felt physical. Something had occurred physically to me.
Okay.
And then when it happened again.
This client has presented with classic symptoms of a panic attack. She has had an abrupt surge of intense fear accompanied by more than 4 of the symptoms listed in Criterion A. So far, she has described heart palpitation, sweating, chest pain, shortness of breath, dizziness, and fear of dying. The diagnosis of panic disorder requires that the client has recurrent panic attacks and that they are followed by 1 month or more of persistent worry about future panic attacks and a significant maladaptive change in behavior related to the attacks. This could take the form of avoiding the place or activity wherein previous attacks have occurred, restricting their daily activities, or, in extreme cases, avoiding leaving the house or other safe places. Now that we've confirmed that she has experienced panic attacks, I will continue the interview asking questions to see if she fully meets the criteria for panic disorder, focusing on recurrence, worry about recurrence, and any related changes in behavior. I will also start ruling out other possible diagnoses and causes for her symptoms.
It was in a refrigerated section of the store. I had been looking at fruit and contemplating what was going to be for dinner. My husband likes fresh vegetables, and so I was there. And again, suddenly, my heart began to push, like it was pushing from my chest, and really like something physical was happening to me in the store, like a heart attack again. Um, But again, I left the hospital, and the doctor was not able to give me any explanation. I'm still not able.
So you said you were at the grocery store and you started to have some similar signs, similar things going on where your heart's racing. Were you sweating
My
during the
palms
second?
were sweating, dizziness. It felt like I was going to fall out right there and die.
Okay. And so that's pretty frightening.
Yes, and die.
Okay. And then somebody at the store.
The store clerk was there. He
Noticed?
saw me, my behavior. I could not speak. I could not get his attention, but thankfully he saw me.
Okay.
Frantic, life-threatening, it seemed
Okay.
to me.
She has now described two similar events that meet the criteria for panic attacks. The DSM criteria for panic disorder require at least 2 attacks for the diagnosis of panic disorder to be considered. Now, I'll be assessing whether she has experienced any traumatic events or significant life changes to rule out post-traumatic stress and adjustment disorder with anxiety. And then they called?
The EMS
The
came
EMS,
and
okay.
take me in the ambulance to the hospital, and they had asked me a bunch of questions like, did I take any medications, did I do drugs, was I a smoker? None of those things are happening in my life.
Okay, so I was going to ask some of those same things. Is there any time that you drink or drink alcohol? No, that's not something that you do. How about any other prescription medication or taking things without a prescription? Or
No, I've worked my job 23 years without a day off. Never had any major illnesses besides common colds, yeah. And so I would consider my life, like I said, pretty routine, pretty stable. These things were sudden and out of sorts.
And then at the hospital, did they perform any tests?
EKG to see if it had been a heart attack.
Okay, so the monitors on your chest. And
I was crying frantically. I thought I was having a stroke that could lead to disabilities. I wanted somebody to ensure me that I hadn't had a stroke.
Okay. And did they find anything at the hospital? No. It is important to rule out any